And now, Plans for Good Health, brought to you exclusively by UnitedHealthcare.
We are turning our focus to a serious topic now. Did you know that the United States has the highest maternal death rate among the world's developed nations? Now, because of that statistic, UnitedHealthcare is working to improve maternal health outcomes across the state. With the help of their recently awarded grant, our next guest is here to tell us more about how they are putting these funds to use. Please help me welcome Dr. Julie Moriel, the Chief Medical Officer for UnitedHealthcare Community Plan of Louisiana. Doctor, welcome to the show, and thank you so much for talking about this topic. I want to start with why maternal health has become such an issue, and then moreover, why is it so important to UnitedHealthcare?
Yeah, Malik, I just want to thank you for welcoming me to the program. We know, let's just paint a foundation here. We know that there's substantial, persistent racial and ethnic disparities in maternal mortality across race and ethnicity, and the numbers are quite frankly alarming. We also know that pre-existing conditions such as cardiovascular disease, rather than perinatal complications or complications during the pregnancy itself, have been identified as the leading cause of maternal mortality. And these other conditions account for some 30% or more of perinatal mortality, according to the CDC. United Healthcare recently awarded $275,000 in maternal health grants to 7 community organizations across Louisiana. The goal is to improve maternal health outcomes, reduce disparities, and expand access to care.
Very interesting. And I think it's so important to note as well that, so many people think, oh, it's all about what happens in the doctor's office. But here's a statistic for everyone. 80% of a person's health is determined by what happens outside of the doctor's office. So it's so important that people know that it's what you do outside of that medical appointment that can really affect conditions like these. Now, I see here again, $275,000. Amazing. You all have actually given these to some local organizations as well. What organizations?
Well, we've given $275,000 to 7 different community-based organizations, including 3 in the greater New Orleans area. In New Orleans, the funds have gone to the City of New Orleans Health Department, their Healthy Start program, Birthmark Doula Collective, and Saul's Light. And as you saw, the grants help with maternal health outcomes and disparities, help provide prenatal and postpartum education, as well as enhance access to primary and preventative care services. As you mentioned, Malik, we know 80% of a person's health is determined by what happens outside of the doctor's office. Those social factors really play a major role in maternal health disparities, including lack of access to wellness and prenatal care, and limited access to educational, employment, and economic opportunities. We know about socioeconomic housing, so housing insecurity and food security. We also know lack of education about overall health, as well as the physiologic stress that occurs during a pregnancy may have an impact on a mom's pre-existing conditions and chronic diseases.
And that's what we're talking about when we're talking about maternal deaths here. This is talking about when women are pregnant, when they're having these babies, they're unfortunately dying due to childbirth. With all of that said, doctor, I want to ask what can women and the moms out there do to be a part of this solution to help combat this maternal death problem we're having?
Well, Malik, it's really important for the moms to prioritize their own health. Women can only help others if they themselves are healthy. It's also really important for them to learn to manage chronic conditions such as hypertension, and maintain a healthy lifestyle, not just during the pregnancy, but prior to the pregnancy, during the pregnancy, and after the birth of the baby. And to feel empowered to discuss your medical history with your physician, including, mental health or behavioral health concerns such as anxiety and depression. It's also important to find an advocate. I call it your perinatal advocate, um, who may speak for you. And it's okay for you to be vocal, ask questions, and raise concerns. It's important to find an advocate who you feel really comfortable with, um,
So
to
true.
help
All
you.
important things, really. And by perinatal, of course, you're talking about the person who is looking after you as you are pregnant. Some great tips this morning. And like we said at the top of the show, this is a problem and we need to make sure we get a handle on it. And thank you to United Healthcare for trying to do your part to help combat this problem. Dr. Moriel, I appreciate you this morning. And hey, to learn more about maternal support, log on to UHC.com. Look for the maternity support link. It'll be on the website.